Is there a treatment for tinnitus or ringing in the ears? I mean, how annoying to have ringing or chirping or roaring or clicking or whistling in your ears. I mean, that's just crazy making. No wonder this study that they did at Loyola showed that people that have tinnitus are 3 times as much depressed as the normal person.
Yeah,
I wonder how often people get this and what's the cause of it?
Well, it's common. You know, when you're looking at 50 million Americans that have tinnitus, that's a big number. And if you're over 50 years old, your chances of having it are about 20%. And about 10% of the general population has it. So it's not something that's unusual. And a lot of the time, we just hear it when it's quiet. And we do our normal daily activities, and it gets blocked out because our brain is very clever about how it regulates what we hear.
Every once in a while I'll get a little bit of that, but it doesn't last very long and it's not very loud.
What happens if there's a loud sound? Very often, like if you hear a gun go off, a shotgun go off.
Well, I don't usually hear a shotgun go off.
Well, yeah, but if you ever have, you've never heard a shotgun?
Yeah, I have.
And your ears just start ringing for a while. If you've been to a concert where the music is terribly loud, those are things that do it. But a lot of other things like wax or infection or allergies do that. And the most common cause that I see in my practice of tinnitus, or even a little bit of vertigo associated with it where you're a little bit dizzy, is if you have cervical disc disease or TMJ problems, if you grind your teeth. Real common cause of it. So those are the kinds of things that are really popular, but the things that you don't really think about so much are
drugs, I bet.
Yeah, you talk about antibiotics of all kinds, chemotherapy, diuretics, even do that, and antidepressants, the very thing that we use as a treatment for it, can cause it, just as drugs that make you anxious can.
And what about NSAIDs, the non-steroidal anti-inflammatory drugs?
Yes, and aspirin. If you have too much aspirin or you have a problem with NSAIDs, it can cause a lot of ringing in your ears, even B12 deficiency. So there are lots of reasons why we get this thing and why it's such a common thing. Hearing loss is another thing that's really common. It's kind of associated with it a lot of the time if it gets advanced.
Well, this can be pretty debilitating, really. I mean, this can like mess up your quality of life if your ears are ringing or chirping or roaring or whatever.
Yeah, we're doing all those things. That's right.
Yeah, it's crazy making.
Well, there are a lot of things you can do to treat this that are kind of novel that actually work.
I hope it's not another drug.
No, well, I mean, that tends to be what we think of. And so the people who did this study thought, well, antidepressants would be a good idea, even though sometimes they cause it, even though the chances of getting tinnitus or ringing in your ears is really low if you take a drug like that. But sometimes it works.
So Loyola did a study. So what did their study suggest?
Well, just that you could use magnetic therapy to treat this, which I think is amazing because magnets in general aren't thought of to be much of a treatment for any condition. We use it for diagnostics because we do the MRIs, but we know, at least if we have an open mind and we've studied it a bit, that it works in lots of areas. It can help with pain a lot. It certainly can help with tinnitus. It works with depression. It works for some people who have cancer, at least that's what we think, and in some complementary and alternative medicine circles. And
there's probably not side effects to speak of. Huh?
No. Well, the people talk about, well, is it really safe in this dose? And I'm going, well, duh. We're using an MRIs, which has thousands of times more power, and we don't question that. But if it's something that's complementary and alternative, well, we have to test that, find out. So it's kind of safe, and it works for a lot of things besides tinnitus. The other things that we can do that work pretty well are things like ginkgo biloba, although I have to say in my practice I haven't had great success with that.
I bet chiropractic might be helpful.
Chiropractic is a great way to do it.
Especially if it was being caused from a cervical disc problem.
Exactly, which is maybe the most common cause of tinnitus in my experience. And the same thing with acupuncture. It can work quite well as well.
But I know what you use.
There's one ace in the hole that's phenomenal that should be out there. It's almost a crime. It is a crime that it's not, and that's infrared light therapy. You have somebody who has a problem with TMJ, where they're grinding their teeth and they get soreness in here, and you can't chew well, and it's painful. Or you have a cervical disc problem. The pain there can either refer to the front of the head and cause a headache, which is very common, and a lot of people think they have sinus infections when actually it's just referred pain from the neck. But they also get this problem with tinnitus and sometimes also with vertigo.
So would you put the light in their ears or in their neck?
I put it over the TMJ, the ear itself, and also in the neck. I have devices that will do that are very sophisticated in the way they deliver infrared light therapy to the body that are much different than just taking an infrared lamp and turning it on, or buying one of these photon stimulators that you can buy basically on the internet, or if you want to go to some websites that are pushing that a lot. Even ads on TV now are selling that. But
well, they're finally catching on. It's just that the power is a lot less than what you use. I know that.
Well, and we deliver it in 16 different ways, so it's really very interesting. What I suggest people do is go to the website at drsaputo.com, put infrared light therapy in the search box, and see what comes up, and you'll find all kinds of interesting things that this light does. It's really medicine for the future. So when we're looking at this whole topic for tinnitus, it's not hopeless, even if it's combined with vertigo. And the therapies that we've talked about, the causes that we've mentioned, are all things you should know about. And the problem is a lot of your doctors won't know this. Maybe your ear, nose, and throat doctors will know some of it, but you almost have to go out on your own, because when we start talking about tinnitus in medical circles, we go, oh, well, there's not much treatment for that. So think about that, and hopefully if you have tinnitus, you'll find a solution.